Now, also breaking tonight, according to FoxNews.com, a new and independent analysis conducted by the American Enterprise Institute warns of a ticking time bomb, predicting a second wave of 50 million to 100 million insurance policy cancellations. Now, that would come next fall, right before the midterm elections. Now, the next round of cancellations and premium hikes is expected to hit employees, particularly of small businesses. We go now to Washington, where Texas Senator Ted Cruz is standing by tonight with reaction. Senator, this is not the only prediction. The Manhattan Institute, many analysts that we've interviewed on this program, all saying the same thing. This is going to keep rolling out for many months. Cancellation letter after cancellation letter, rate shock after rate shock. What is the long-term impact of all this?
Now, Sean, you're exactly right. Obamacare is a disaster. It is hurting millions of people all across this country. Sadly, all of the concerns of the millions of Americans who spoke up for months are coming true and proving even worse than was feared. We're seeing millions of people who've lost their jobs, who are forced into part-time work, and over 5 million people have already had their health insurance canceled because of Obamacare. And as you noted, there are more shoes getting ready to drop. One of the next shoes that's going to drop is more and more Americans are going to discover that they can't see their doctors. You know, Texas Oncology, one of the largest oncology centers in Texas, has just announced it's not going to participate in Obamacare. I have good friends who are cancer survivors who are struggling with the fact now they can't go to their cancer doctors anymore. After that, we're going to see this spring premium increases, dramatic premium increases, because so few people are signing up on the Obamacare exchanges, and those that are signing up are not the young, healthy people that they want to subsidize everyone else, and so big premium increases are coming. And then you noted what I think is the most problematic development of all that is expected next year, which is small businesses and large employers dumping their health insurance and the potential for over 100 million people losing their health insurance because of Obamacare. This thing is not working, and it's time to start over.
But, Senator, we know now that they knew this back in July of 2010. There was a November 2nd Wall Street Journal report that said they debated the issue of telling the American people the truth back in July of 2010. What does that mean? How should the American people interpret that in light of most people don't see the president as honest and trustworthy anymore?
Well, it's a really sad reflection of the cynicism of this administration and the cynicism of this president. You know, there's a strange trade-off at the heart of Obamacare. There were roughly 45 million people who were uninsured. Obamacare is endeavoring to insure about a third of them, somewhere between 15 and 20 million people. Even fully implemented, there'll be about 30 million people that don't get health insurance. That trade-off, though, look, there are a lot of people that would like to see more of the uninsured be able to get health insurance, but the trade-off behind Obamacare is to extend it to that 15 or 20 million people. They are jeopardizing the health insurance of some 200 million Americans who get health insurance in the private health insurance market. They're causing millions of people to have the plans they like right now be canceled, and they're driving up rates all across the country. And that's, if they had been honest about that trade-off, if the president had said to cover 15, 16, 17 million people, we're going to mess up the insurance for 200 million Americans, he would have been laughed at. Nobody would have gone down this road. And that's the reason why they instead decided to make a promise, to willfully make a promise that they knew was false.
It's an ominous sign when a government spends hundreds of millions of dollars and has 3 years to prepare a website, and the way this has been rolled out. Yesterday in Miami, Kathleen Sebelius, you know, a woman was trying to sign up for Obamacare, and let's show everybody what happened in this instance.
I think it's great that this is happening.
Well, it's been a long time coming.
Yeah.
The screen says, I'm sorry, the system is temporarily down.
Well, it's okay. It'll come back. You know, that happens every day.
Look at that screenshot. It says, sorry, our system is temporarily down. Now we're being told, Senator, that they may not even meet the deadline of the end of the month.
Yeah.
So what happens then? Isn't there a series of events? Don't they need individuals to sign up for this whole thing to work?
There is. And, Sean, we knew about the problems inherent in Obamacare, that it was going to take away people's health insurance, drive up premiums, kill jobs. What we didn't predict was the disastrous incompetence of the administration rolling out a functioning website. You know, there's 17-year-olds that can design a website and sell sneakers online. But apparently this administration, despite having 3 years, can't get a functional website. And what that has functioned as is basically an accelerant. It's like throwing gasoline on the fires. It has made all of these problems far more severe, far more quickly. And, you know, at this point, I'm convinced it is the essence of pragmatism to stop Obamacare and to stop over. 3.5 years ago, it might have been that reasonable minds can differ, that perhaps some could have thought maybe Obamacare might work. You and I didn't think so, but perhaps others could have. Today, nobody's making that argument. Today, you can't look at this disaster, at millions of people losing their health insurance, losing their jobs, forced into part-time work, and conclude anything other than this isn't working. And so the pragmatic, common sense result of that is to say it's not working, let's start over.
I agree with you. Now, it's very interesting that when you were in the middle of your 21-hour and 19-minute, not filibuster, but speech on the Senate floor, you had a lot of critics, and some were even within the Republican Party. One of them was John McCain, that said any issue to delay or appeal or replace or even delay this was irrational. At another point, called you a wacko bird. He was on with Greta on November the 13th, and now he's sounding a little bit like Ted Cruz, in my opinion. I want to get your reaction to this.
Let people go across state lines to, in order to, if they can get a better insurance policy in another state, and remove this whole tax incentive for employers to provide employees health insurance.
That is repeal. That's repeal.
That's right. That's exactly right. That is total repeal in every other way, because what Obamacare is an experiment in social engineering.
He said elections have consequences. It's irrational. Well, what's your reaction to that, considering he, more than anybody else, was firing away at you at the time?
Well, Sean, I agree with John McCain, and I'm glad we're on the same page.
But not then.
But, you know, the great thing is success has 1,000 fathers. Failure is an orphan. I am happy for everyone in the Republican Party who wants to claim success and parentage for us coming together and repealing Obamacare because it isn't working. And the more who come together, the better chance we're going to have of actually successfully empowering the American people. You know, if you want to expand health insurance, the way you do it is you want more choices and you want lower costs. What Obamacare does is it provides fewer choices and higher costs. And so it's great that we're seeing so many people come on board. We welcome them all.
All right, so CBS has the president at 37%. I mean, they're almost near Nixon numbers in terms of approval rating. In the ABC Washington Post poll, on 3 measures of leadership and empathy in that particular poll, he's underwater for the first time in his presidency. People don't see him as a strong leader. They don't see him as somebody that understands people like them, and they don't view him as honest and trustworthy. So with that in mind, is it possible, as you now move forward, in your opinion, that this really can be repealed, that this can really be stopped, and how would you go about doing that?
Well, I believe that's the only answer. You're seeing President Obama and the Democrats propose Band-Aid fixes that are cosmetic. Some of them have great names, like if you like your plan, you can really, really, really keep it.
Yeah.
But they wouldn't fix the problem. They wouldn't give real relief to the over 5 million people who've lost their health insurance plans. And, you know, the president apologized, but an apology is only meaningful if you make it right. And the way to make it right is to repeal it all and instead to allow people to buy insurance across state lines, have real choice, real opportunity for patients to control their health care, not the government.
All right, Senator Ted Cruz, always good to see you. Thank you for being with us.
Thank you, Sean.
And coming up next, right here tonight on Hannity.